Good morning. First, I just want to thank the committee and for inviting me to be here. I'm really excited to get to share with you a little bit of my thoughts on the evolution and foundation of precision medicine and some of the things I remember from the perspective of the National Academy's report. So in terms of the evolution and foundations, I think of this as what is precision medicine and how did we get here? And so what is precision medicine? I'm showing here the definition that the NIH uses in the Precision Medicine Initiative and for all of us. Precision medicine is an emerging approach for disease prevention and treatment that takes into account people's individual variations in genes, environment, and lifestyle. And I like this because it's very clean and it really gets to the point. But I will say that the word approach, that this is an emerging approach, really is doing a lot of heavy lifting because the approach is really where the data, being able to integrate the basic research, clinical data, population health data, and being able to put all those together, connect them, and then have the applications in a variety of spaces is kind of represented to me in that word approach. So the lens that I'm going to be taking is through the Toward Precision Medicine report, building a knowledge network for biomedical research and a new taxonomy of disease, which was the National Academy's report from 2011. And so how did we get here? I think it really starts with the Human Genome Project and as many things do with another National Academy's report, mapping and sequencing the human genome. This was a report by Bruce Alberts as the chair, and this committee really laid out and made the call for the Human Genome Project, really encouraged and helped motivate making that happen. And roughly 10 years later, we achieved the Human Genome Project, and I say we because this is, an achievement of mankind, so, I wasn't there at the time. But this was announced in 2000, the completion of the human genome with, Bill Clinton, and there's Francis Collins, and I'm sure Craig Venter is probably in there somewhere. And this was published in February of 2001 in both Science and Nature. And so then 10 years later, of course, we had, with the human genome in hand, we had solved all the mysteries of human biology and cured all disease. And so all work was done. But instead, of course, 10 years later, there was a lot of discussion about what we had accomplished, a lot of cause for celebration, but also reflection on what had not yet been achieved, why, and what should we do going forward now that we had the map of the human in hand. And in this commentary from Scientific America in 2010, Francis Collins noted that often, that the first law of technology is that we overestimate in the short term and underestimate in the long term. And I'll just point out here that with the Human Genome Project, there was a lot of talk that, one, this was already happening, why do we need this as a major project? Or this is impossible, it will never happen. Sometimes from the same people, it will never happen and it's already happening. And this is just a buzzword. So I think those kind of things happen a lot with these types of large efforts. And so in this period of reflection and thinking about, okay, now we've achieved this amazing thing, what do we do with it? How do we cure all disease? There is also pointing out there's a lot of opportunity, and the human genome cost $400 million to sequence, whereas today being in 2010, it was about $10,000, and the thought at the time was that in the next 4 to 5 years that it would only be $1,000 per genome. And so we were really at this moment of great potential and other technologies as well. And I'm just showing here the kind of obligatory slide of Moore's Law and the cost of the human genome. And this was the figure that was in the Precision Medicine report. And I'll just show you in 2016, roughly, 5 years later, in fact, it was about $1,000. And so there was, again, this opportunity, where do we go next, and a lot of thought for that. And so Francis Collins and the NIH went to the national academies and said, how do we think about the underlying mechanisms of disease? How do we take what we've learned from what's available from the human genome and really apply that? How do we think about disease based on these underlying mechanisms? And instead of considering signs and symptoms to treat patients, really look at those, what we know from molecular biology and what we can learn there. And so just two really quick points. Again, this was about neither the statement of task nor the background material ever mentioned, precision medicine. This was about creating this new, is it feasible, is it needed to develop this framework for a new taxonomy of disease? And then again, pointing out that we're really at this amazing moment, at an inflection point, and we still are at this inflection point, where we can really put the life sciences are really at the cusp of delivering these dramatic improvements. And so how do we best move forward with the opportunities and the new technologies? And also a recognition of the, not just the human genome, but computation, a little bit with AI and mobile technologies. Those were not, as obvious. Certainly computation was as part of the opportunity. So then with the committee, this was co-chaired by Sue Desmond-Hellman and Charles Sawyers. And so I just want to point out for this, the committee, I don't know if I have a pointer, but we had, represent experts from microbiome, geneticists, social determinants of health. There are basic researchers, practicing physicians, and public health experts there. So they're really thinking about the issues very, very broadly. And what the committee said is, yes, we think it is feasible and we think it is needed to create a new taxonomy of disease. And how we're going to get there is it's going to require that researchers and healthcare providers have access to very large data sets on health and disease, and that this needs to be linked to individual patients. And that if we do this, we'll create a new taxonomy of disease. We'll also be able to realize, and this is the path to being able to realize the full promise of precision medicine. So the committee really used the analogy of what they said, we need to build this knowledge network, and they used an analogy of Google Maps. And so in the case of Google Maps, that's built on GIS layers organized around geographic positioning. So where are the roads, where are the waterways, where are the Starbucks, how do those relate to each other in space? In the case of the knowledge network, the idea is that we have, again, these many levels or layers of data, genomics, microbiome, the exposures and behaviors, and then also data around clinical tests, and being able to, and others, and being able to align those, in this case not longitude and latitude, but instead around an individual patient, to connect across these layers, and then the connections between layers and between individual patients. That's really where the research comes in, and being able to understand those correlations and have that greater understanding of those mechanisms. And so I think about this as sort of three spaces of the basic, the clinical, and the population level, or maybe the genetic code, the billing code, and the zip code. And that just as we need information from all of these areas, we also that the output is in really these three spaces as well. So not just to improve clinical care, but this is really also going to accelerate new discoveries, and again, those underlying mechanisms, and it can also inform public health. This is one of the figures that's from the report, and I mostly put this one here just in case. I know you have later. If you wanted to use it, this one, I'd need to show it. So it gives a little more detail about the target identification and markers and molecular mechanism piece. But this is the graphic I use now, or as we're thinking about it at UCSF. And again, the importance of individuals, but also thinking about them at the population level, and certainly the experimental systems. and being able to gather data and then understand that through the lens of research and discovery in basic clinical and population health research, enabled by computation, by digital health, and by omics, not just genomics, but again, microbiome, metabolomics, et cetera, and those technologies to help build the information commons, make those connections, and the output being data in, knowledge out. And that this is really a cycle that needs to be accelerated in all of these spaces, and that it will help drive new technologies, new discoveries and hypotheses, and of course the more precise diagnostics and treatment, as well as prediction and prevention. So I think this is my last slide. I wanted to mention that we in considering this, we had thought very much about the ethics and the legal and the social components and importance for precision medicine in each of these elements. And at least on this graphic, we don't have it represented explicitly here, and that was because we didn't want it to look like it was sort of an add-on or an afterthought, but instead it is embedded and essential into each of these areas. Of course, what we've realized in discussion now is that we may know that, and we may talk about it, if you click on one of these within each of these sub-web pages or something as we're thinking about it, and there are representatives on our committee at UCSF that are certainly raising all of those issues, but it needs to be there more explicitly. So we are going to add the participant engagement and the importance of representation and inclusion, and really health justice, and that those are important components of precision medicine, and needs to be thought of as we're thinking about a framework or for animal models, that needs to be something that we're thinking about for all of these elements. And I'm not sure where I am on time, so I'll just one more quick note is that we had. This committee had mentioned a few, of course, recommendations. One of those was that the importance of pilot projects to really get this started, and that the one example was MAGI, Million American Genome Initiative, and I think that's very much in keeping with all of us, but the importance of following that with the research discoveries, really understanding, how is that data going to be used once we collect and build this amazing cohort, in this case with all of us, how are we really going to understand that and then use that data? And I think that's where I'm so excited to see the attention to animal models and taking it back to the basic research and understanding. So, thank you.